Please welcome the Rural Center Director of Advocacy, John Coggin.
Good morning, everyone. Allow me to quickly reiterate Patrick's earlier thanks to you all for taking the time to be with us today. Your commitment to rural North Carolina is inspiring, and I am honored to work alongside all of you on each of these important issues. We turn now to the health section of Rural Day. Now, many people do a double take sometimes when they hear the Rural Center talking about health. And we admit we are not experts when it comes to healthcare delivery. You don't want me giving you any medical advice, especially after the number of cinnamon rolls that I ate this morning. But at the Rural Center, we do come at this conversation through our depth of experience in rural economic development. At the end of the day, we want to see good, well-paying jobs in North Carolina. But those jobs don't happen in a vacuum. We have to cultivate a flourishing ecosystem to support those jobs, one with strong education, infrastructure, civic life, and health. If we don't have healthy people, we can't have a healthy economy. And the health sector itself is fundamental to overall economic competitiveness. Health sector jobs are good, well-paying jobs. In fact, the health sector was one of the few to grow over the course of the Great Recession. In our 80 rural counties, taxable wages in the health sector have grown 36% since 2000. Compare that to 7% growth over all private sector industries. A community with a robust health sector will be better prepared to compete for big companies, small companies, new families, and the next generation of citizens, workers, and leaders. The challenges facing rural health are many, and there is no silver bullet. We do need to do more to attract providers to rural areas. This can be accomplished by hosting more residents at rural hospitals, increasing loan repayment programs for graduates who commit to rural areas, and giving full practice authority and appropriate scope of practice for a range of providers who want to serve rural communities. We must also expand the reach of telemedicine and tackle the substance abuse crisis that is plaguing too many of our friends and families. We can't just pick one thing from this list. We have to simultaneously work on them all. However, there is one action that we must take before any of the rest will be effective. We must close the health insurance coverage gap in North Carolina. The state's refusal to tackle this crisis is hurting hundreds of thousands of hardworking North Carolinians who have no affordable option for health insurance. It is hurting those of us with insurance. And it is hurting rural healthcare systems which are already struggling to stay alive. According to the Shep Center at UNC, there are 7 financially vulnerable rural hospitals in North Carolina. As we speak, the hospital in Little Washington is in bankruptcy. If we were to lose these hospitals, they would take with them an estimated 2,300 jobs and $2.7 billion in state GDP. We cannot afford to lose these lifelines to health and economic sustainability in rural places. Closing the coverage gap will go a long way toward helping these struggling facilities meet their bottom lines. Of course, closing the coverage gap will not solve all of our health problems, but without taking this vital step this year, we are crippling all the other strategies for rural health in this state. But don't just take my word for it. We have an amazing lineup of speakers prepared to give you a fantastic overview, not just of the coverage gap, but in all of the ways we can work together to improve rural health. We start with Alan Morgan, president of the National Rural Health Association. Alan has been working for almost 30 years in rural health policy, serving as staff for U.S. Congressman Dick Nichols and former Kansas Governor Mike Hayden. He then spent years lobbying for multiple health organizations before joining the National Rural Health Association, or NRHA. Alan is recognized as among the top 100 most influential people in healthcare by Modern Healthcare magazine. And I can tell you from my experiences attending his national conferences that under his leadership, NRHA has become the most trusted name in rural health policy in this nation. Here to share with us a national landscape of rural health access and give us a glimpse of what North Carolina can do as we seek a brighter future for the health of all of our people, please join me in welcoming Alan Morgan.
Good morning, everyone. Can you hear me okay in the back? Of course you can. I'm with the National Rural Health Association. Our tagline is, your voice louder. We mean that not just figuratively, but literally as well. Happy Rural Day. Come on, get excited. Yes. When Patrick called me and extended the opportunity and asked if I'd be willing to join you here on Rural Day, I said, absolutely. That's like asking a kid if they want to go to Chuck E. Cheese on their birthday. You got to get excited about today because this is a time for us to come together, celebrate what works well in rural America, and talk about how do we sustain a rural community and a rural lifestyle for the future. Now, you heard so far already this morning the challenges that we face in rural America. And there are many. But what I want to talk about also are the opportunities we have, certainly from a health perspective as well, too. And you also heard this, do some rural communities feel left behind? I'm from a small Kansas town in northeast Kansas and a farm kid myself. And I understand sometimes the perception that rural is left behind. I understand the perception. But what I need to convey to all of you today, what we need to share is while that may be the case in some rural communities, going forward, there is no way that rural does not lead the United States going ahead. Certainly when it comes to our healthcare system and where we're headed as a nation. As long as we tell our story correctly, which is a challenge, right? It's oftentimes to tell our story accurately. And this picture, this slide, just illustrates the problem that we have. Isn't that a glorious picture? You've got the dad and his daughter and the sun shining, and they're looking on to workforce shortages, vulnerable populations, chronic poverty. That dichotomy of a great future and a strong community and the ability to see a family and a future for a family has to be weighed with the challenges that we face as a community as we move forward, which leads us to the importance and the relevance of today. The relevance of today. And let me share with you in a nutshell the key advocacy message that we take from a national level. And that is, yes, in rural America we have workforce shortages, and we have health disparities, and I'm going to talk about that. But what we also have is the ability to collaborate, a sense of community. When you look at a population that is underserved, rural America nationwide is becoming more diverse, but we have shortages of resources. Rural America today is where our country as a whole is going to be 20 years from now. Limited resources, aging population, healthcare disparities, workforce shortages. It is imperative as a nation we solve the rural problem now so that way we're prepared to solve the nationwide healthcare crisis 20 years from now. This is the opportunity for rural communities to be test beds for what works, what doesn't, figure it out, and to grow from there. And that's really the key message that we have going on. I like this slide, and there's a good chance that you've seen a version of this slide in the past about life expectancies. This one, I actually made this more concise so it's easier to follow because this had male, female, metro, non-metro. I just stuck with metro, non-metro to make a key point. If you see, the lines diverge. The lines diverge in the early 90s. In the early 90s, life expectancy for metro continued to rise while non-metro began to lag behind. This is really important to recognize. Are you talking metro, non-metro? Are you talking rural, urban? Because this data, which is shown so often at the national level, is metro, non-metro. They've lumped in these great suburban communities with us, and we're still trailing behind. That's because in a rural context, there is declining life expectancies. And this has become so great, hopefully you've caught the unfortunate news last week that now as a nation, we have declining life expectancies as well. So there is an imperative for us to address that. Okay, what is rural? Don't answer that. Don't answer that. Once you get into that discussion of what rural is, it is a never-ending discussion. The federal government has 72 ways of defining rural across their programs. 72. An easy way to do it is, if you're in a rural community, you know you're in a rural community. I've never had any of our rural members ask if they're rural. Rural people know. For us, what I try to share at a national level is a great way of determining where rural is to look where our membership is located at. North Carolina, can everyone see their dot in the back? Well, if you don't, a plug to join the National Rural Health Association. What I want you to do is just look at the shape of this map. Just look at the shape of it. I'm going to drag you through a couple of slides to make such an important point about what you're doing this week. Okay, where NRHA membership is at and where rural is at. Now let's look at poverty in America. Do you see a correlation? You should. Rural populations are much more inclined to be lower income than their urban counterparts. What else is a common component of rural? Uninsured. See the commonality? So now you're starting to see where rural is often the place where you also have low income and uninsured. Rural populations that are low income and underinsured. I wish there was a federal state program that would address this. Medicaid, we have it. That is what Medicaid is designed for. That is a key component which you're going to be talking about this week. How can Medicaid play that important role in addressing both health disparities and ensuring the economic vitality of these rural communities? Another map, and again, you're going to see the same correlation. I use obesity because obesity is a nice proxy for hypertension, diabetes, stroke, all the other disparities that you have on it. And again, you see a situation evolving that rural is not a small version of urban. Rural America is a unique healthcare delivery environment where those people most in need of healthcare services oftentimes have the fewest options available to access that care. And that's part of the moral imperative of why we're here and why we're advocating on behalf of rural communities. This death gap between urban and rural is increasing. It's increasing steadily. When you pull out some of the key drivers of why this is happening, it's easy to see why rural is struggling when it comes to these type of issues, issues of health access from a rural context. And cancer is a good example of it from a clinical standpoint to look at. What is driving the rural cancer deaths? And it's important to note, urban residents are diagnosed at a higher percentage for cancer than rural, but mortality rates by percentage are higher among rural. Our friends, our family are not becoming diagnosed at a proper time. They're not having colorectal and screenings like they should. Higher rates of smoking among rural populations. All that is driving part of this mortality rate that we're seeing in a rural standpoint. Behavioral health. And from behavioral health, I include the substance abuse crisis that we're dealing with now as well too. What are the key drivers of mortality in a rural context? Well, cancer, COPD, unintended injuries, and the CDC lumps in the opioid crisis and deaths into unintended injuries. And this map just shows that no matter what region of the country you're talking about, when you go from left to right, you're going into more rural communities, the instances of mortality among suicides increases. And I mentioned the concept of knowing that you have to have access to providers to address this. From a behavioral health standpoint, we don't have that. So it's not surprising to see this crisis. The opioid crisis, which you all are well aware of, impacts rural and urban both, but the transportation and the housing issues and the access to behavioral health specialists make it a unique concept among rural populations. So as we address this, we need to think about rural solutions. The makeup of all of you here today is so important, especially of what is the path forward for this, and certainly for the opioid crisis. Right now, across the U.S., we're trying to decide and determine and evaluate what are the best practices in dealing with the opioid crisis. There is one commonality across all rural communities. Successful rural communities that address this crisis bring together sheriff's department, school system, the hospital CEO, and small business together because each has an important role. Let's be honest, that's not brain surgery. This is what makes rules strong. That sense of community and the ability to collaborate across industry sectors. It's so very important. That same strategy is what's needed to address declining life expectancy and also the poverty rate in a rural setting as well too. Earlier was mentioned the hospital closure crisis that we're in the middle of, certainly impacting the great state of North Carolina. 103 rural hospitals have closed since 2010. To me, that's not the story. And that's not actually accurate. To be honest with you, 112 rural hospitals have closed, 112. But those 112, some of them have actually reopened, but less than 10% have reopened, which makes the point. If you lose your community anchor institution, you lose that hospital, you have less than 10% chance of ever getting that hospital back to your community. Once it is gone, it is gone. Number one. Number two, at the National Rural Health Association, we collect data on all of the nation's hospitals. And our data projects 1/3 of all rural hospitals in the United States closing over the next decade without local, state, or federal intervention. That Medicaid issue, which I mentioned to you earlier, is not just a moral imperative, it is an economic necessity because in these rural communities, the patient volume are predominantly uninsured, low income. If you've got that patient population and you simply cannot bear the economic weight of this from a hospital alone. And that Medicaid solution is one solution that's been shown through research to actually help keep these communities' healthcare access locally. So, you've been looking at this slide. The Lieutenant Governor referenced the Jetsons. Did everyone catch that? Yeah. The Lieutenant Governor, all of us, this was what we were promised, right? We were promised this. We were promised the flying cars, the robots that were not just small circular devices that get stuck under our chairs, but actually full-grown robots and telehealth that works. That is not what we're seeing in many of our rural communities. And as you heard also, the key to driving this is going to be broadband access. That is such a key point. You've got to have this. And let me make two side notes from a health component on this. When you talk to policymakers about telehealth, telemedicine, the first thing they think is access to a primary care physician, which is great. And let's keep on that message. But two other things which are equally important, which are playing out right now and are necessary from the telehealth standpoint. Number one, teleconsultation. For a rural primary care physician that's working in ER in a small town, to be able to access a trauma physician at a larger institution, to be able to just bounce ideas off their peers, to know that they are not alone out there practicing, so very, very important. And number two, the recruitment and retention of physicians for communities. Again and again, the kids that are getting out of medical school, they're used to using this technology, and they want to know if they do go to a rural community, they're not going to be stranded out there alone. So the argument and the pitch that I'm making to you from a national perspective is broadband access and the subsequent telehealth and telemedicine is equally important, if not more so, to the recruitment and retention of healthcare providers across our community. Now, that's enough of the bad stuff. Let me wrap up now by saying what we have that we have to tout, and that is, again, the ability to collaborate across sector between law enforcement, small business, education, and health together, doing that, which rural is much more inclined to do as well as in those regards. And let's talk about quality. Generally speaking, healthcare delivered in a rural setting is primary care. Looking at Centers of Medicare and Medicaid data nationally, primary care is actually better in many rural communities than it is in urban areas. Yes, that's true. That's a story we don't tell enough. But it makes sense. If you're dealing as a primary care physician and you know the family, you just saw them at the ballpark, you're going to see them at church, you're going to see them at the grocery store, you know the way that they eat a lot of their meals at Mickey D's, you understand the family history behind it that an urban-based physician will not. There's a real strength to the primary care aspect of it. Let me end with the simple question. Why should we care? Policymakers, I hear that a lot at the national level. Why should we care? Rural is older, they're dying, they're moving out. What are you going to do? At the end of the day, it's so important just to stick with the data. Stick with the data. What does the data show? And what the data shows that nationally, over the last 5 years, there's been a rural renaissance. Populations among rural communities has been growing. Populations of rural communities adjacent to urban areas have been growing even more so. And this is not just baby boomers moving back to relive their childhood in their communities. If it was, you wouldn't see a correlation of young students in schools increasing as well. The story to be told about rural America is as we expand broadband slowly and painfully, it provides us an opportunity to live where we want to live. To live where we want to live with a sense of community, a sense of family, in an environment that gives us what we want. So as a nation, as a state, it is imperative for us to focus on maintaining this rural lifestyle. Let's be honest. Summer vacation, where did you go? Where are you going to go? Urban people go camping, they go hunting, they go fishing, they go to the beach. Show of hands, how many people went to downtown Detroit for summer vacation last year? No? That's right. Rural is where we want to be. We have to be that strong voice. We have to be that strong voice. Key among this, the policy topic I want to close with today is access to clinical care. Rural America is innovating in multiple areas, whether that's the importance and the relevance of allowing nursing professionals to practice to the full extent of their licensure, whether it's new innovative models such as community health workers, dental health therapists. If an individual can be shown to clinically provide health care safely and effectively, through their training, they must be allowed to provide that care. We have to expand access to make sure that rural America is a place for all of us to live and to thrive in. Thank you so much for all you do, and good luck with Rural Health Day.